How can Qigong help pain? Hi, I'm Jeffrey Chand, acupuncturist, practitioner of traditional Chinese medicine and Qigong instructor. In this video today, I'd like to talk about pain and how Qigong can actually help you. Now, I need to distinguish that there's all different types of pain that we can be experiencing. Generally, you can say that we have acute pain and then we have chronic pain. Acute pain is something that's more immediate. Imagine you're walking and you stub your toe. That would be acute pain. It'll come on suddenly and it'll last for a little while and then slowly go away. Chronic pain, on the other hand, is something that could be there because of degeneration, arthritis, or some pre-existing condition. And this is low grade. It can last, it's been around for a long time, a minimum of 2 months, but more than that. And it's always there. The intensity of it is a little bit less than acute pain generally. Now, what I want to mention with Qigong in pain is this idea of the pain body. So if you can imagine that we have our physical body, and then right beside us we have what's called our pain body. And this is almost our ability to be able to tolerate and hold the pain that we have. So again, you're walking along, stub your toe, it hurts, it fills up that pain body, maybe 30% or so. Then the pain goes away and then you go to sleep, and then next day it's still there a little bit, but then eventually it's all gone. And then the pain body empties out. Now when you have chronic pain, you get a little bit of pain, maybe 30%, you go to sleep, and then by the time you wake up it's still only 20%. And then next day it gets a little bit higher again, 40%, go to sleep, and it goes down to 35%. So over time it gets bigger and bigger and bigger, to the point where that pain body is full. Now, if you ever start to feel like, oh, you know what, I can't handle this pain anymore, it's because that pain body is full. If you feel like what you were able to handle before in the past was tolerable, was easy, you could handle it and just go on with your everyday life, but now you can't do that anymore, that's because the pain body is full. So Qigong practice will help clear out that pain body. And we can find some Western medicine equivalents of this idea, but in ancient times they talked about this idea of this pain body being full, and that Qi is stuck and stagnant in the body. So with an overall Qi circulation routine, you can help to dissipate the stagnant Qi and empty out that pain body. Now, I've seen this happen a lot of times in the clinic, in my acupuncture clinic. I see a lot of people, unfortunately, who are just on the waiting list to get a shoulder replacement, knee replacement, or hip replacement. And so they're just waiting until their surgery time actually comes up, and their body's so full of pain. So with acupuncture, you can actually reduce some of that pain, but it does come back because in a lot of cases it's just bone on bone. So when a person can start practicing Qigong, they can start to feel like, okay, that pain is still there, but it just doesn't bother me anymore. I've heard many people say that. So that's sort of an idea to have in mind if you are practicing Qigong to help manage your pain, is just kind of to empty that pain body out so that you can tolerate it, and so that way you can also keep up with physical therapy, more directed Qigong exercises and therapy that will help you actually deal with the pain at the root level. So have you ever experienced this pain body being full? How did you notice that it's full, and what have you done that's been effective to help clear that out? Let me know in the comments section below. If you're interested in learning more about Qigong and practicing Qigong routines, come visit us at qigongforvitality.com and become part of our Communi-Qi. Thanks for watching, and we'll see you again.